Thank you to Sherry and Corianne from Patchogue, two best friends fighting on the front lines together in the ER at Good Samaritan Hospital. Thank you to Anna, an echo tech at Mount Sinai South Nassau in Oceanside. Thank you to Laura Beth, a cardiac radiology tech at Long Island Community Hospital in Patchogue. Thank you to John, an NYPD lieutenant from Deer Park. And thank you to Paul, a power plant operator from Miller Place. Are you an essential worker or know someone who is? And we want to hear from you. All we need is the picture, the person's name, the village or town, and what that person does for a living. Every night, right here at 7, we will be thanking the people who have been on the front lines during this pandemic. Just go to the News 12 Facebook or Twitter page. Good evening, I'm Stone Grissom, and welcome to our live coronavirus pandemic special report. Tonight we have a doctor from Cohen Children's Medical Center to help you sort through what's going on with COVID-19 in our communities and across the region. And as always, every night we want to hear from you. This is a call-in show, so call us. The number's right there at the bottom of the screen, 516-393-1800. Well, Governor Cuomo today announced in-class summer school now canceled. It will instead be done through distance learning. Mr. Cuomo says it's still too early to determine whether schools and colleges can reopen. That's the fall semester. The decision comes as cases spike for the mysterious inflammatory illness in children believed to be connected to COVID-19. Now, the governor is still considering whether summer camps should be allowed to open. Now, he says if he had young children, he personally would not send them. Now, Cuomo says the overall trajectory of the virus spread and its impact is down. That's the overall. The new cases are falling. Statewide, look at that right there. Those are the numbers. Statewide, more than 346,000 people have been infected since the beginning of the pandemic. Long Island, we account for a little more than 78,000 of those cases. Now, Long Island's also sliding backwards in the metrics needed to reach phase 1 and begin to reopen. County officials say we have now only met 4. There are 7 benchmarks required by the state. We're only at 4 now. We were at 5, now we're at 4. We're lacking in hospital capacity, contact tracers, and that 14-day decline in deaths or fewer than 5. Now, more than 23,000 New Yorkers have lost their battle so far with the coronavirus. Think about that. More than 23,000 New Yorkers. That's statewide. Those numbers are people. The Nassau and Suffolk combined death toll, that's here on Long Island, 3,800. All right, let's get to our discussion right now. Dr. Nancy Palumbo, Division Director of Pediatric Hospital Medicine at Cohen Children's Medical Center. Thank you so much for coming back onto the program and giving us your time and your expertise. How are you and your colleagues holding up? I mean, I know it's been, 3.5 months? It must feel like just one really long day for you.
It does, Stone. Thank you so much for having me this evening. We are doing okay. We're definitely hanging in. Definitely have seen improvements. You know, we've seen the numbers that you've mentioned. That improvement for sure. Now is a little bit of a game changer with now having our kids coming in with this inflammatory illness. So we're working through that now.
Yeah, you know, we say the numbers every night. I almost feel like we should, I know we have to, and we should actually put them out there, but it's almost a numbness to the fact that I hope people aren't just getting used to these big, large numbers. How is it on your end? I mean, that must be just horrific to have to live through that on a day-to-day basis because you see the faces, you see the bodies that you're dealing with.
Absolutely. You know, I think certainly for our adult colleagues, that's part of their, day to day. And it never gets easier. It doesn't get easier. It shouldn't get easier, right? Because, even adding 1 to that number is unacceptable, right? Is difficult, is very challenging.
Yeah. All right, let's get to some of the questions right now. Maritza from Central Islip, is that you?
Yes, this is Maritza.
Thanks for calling, and what's your question tonight?
My question is, how does COVID-19 affect the brain, and does it have any mental side effects?
Thank you so much for the question. Headaches. So I'm not sure if you can hear me, Stone, but they do complain of some headaches. We have not really seen any other symptoms in terms of any inflammation of the brain or anything like that. That seems to be a bit more on the rare side. But certainly folks do complain of some headaches and, of course, you've heard of the lethargy and things like that. But we have not seen other manifestations, at least not commonly, of it affecting the brain.
Yeah, and I know that Northwell Health did a recent study, about 5,000 patients, I think it was, where about 30% of those patients who were hospitalized actually ended up with acute kidney infections and ailments. So it seems to not just be limited to the lungs, right?
Right. There certainly were a good number of patients that had a kidney injury. And certainly those patients that then are on the ventilators for prolonged periods of time then may have, other organs affected, such as their heart, for example, in addition to their kidneys.
Okay. Let's go to Joyce from Bethpage. Joyce?
Yes, hi. Thank you for taking my question. My lab states I am antibody positive A. I heard there is also a numerical result, such as greater or lesser than 1.4. How do I know if my test result is really positive and I have enough antibodies to donate plasma?
So thank you so much. That's a very good question. I think that if you are antibody positive, I would contact the center to donate plasma. There's a lot of questions about our antibodies in terms of will they protect us against COVID going for the future. And unfortunately, we don't quite have those answers yet. So certainly being positive is I think, definitely a reason to contact the center to see if you qualify for donating plasma.
Okay, let's see if let's go to Flanders. Philip, you there?
Yeah.
What's your question tonight?
Oh, my question is, does a microwave kill the coronavirus if you had your mask or if it had no metal or your scarf or gloves? Would the microwave kill the germ?
So thank you so much for your question, Philip. I mean, I would recommend not really putting anything into the microwave. I think, in terms of masks, there's lots of different creative ways to cover your nose and mouth, whether it's with a kerchief or, making a mask at home, that I wouldn't recommend putting anything in the microwave, trying to sterilize anything that way. I don't think it's safe. I would just use, another piece of material as a mask as opposed to trying to sterilize it in the microwave.
And doctor, could you just kind of give us an idea of the medical perspective as we begin? We're sliding back and inching toward phase one of reopening. That it's important for people to still maintain that social distancing and wear masks and gloves when you're out in public, right?
Absolutely. I think the mask is incredibly important, and socially distancing. I think that as we go into that phase one, we're all concerned as to what is going to happen. And I know that the weather is getting nice, and certainly it's important to get fresh air and to take a nice walk. But I think to keep in mind to continue to socially distance and wear your mask. As time goes on, we'll know more about this virus and the prevalence and how much it's out there. But in the meantime, stay safe. Stay safe.
Okay. How about Bob from Lindenhurst? Bob, you there?
Yeah, I'm here.
Okay. What's your question then?
Is Kawasaki disease an indication that new diseases may occur here on Long Island?
So, Bob, thank you so much for your question. Kawasaki is something that we've been treating for a very long time in pediatrics, and are very comfortable treating it. And we actually see Kawasaki this time of year. We don't quite have a clear understanding as to what causes Kawasaki. We think that it may be viruses that may trigger that response in children. But certainly this year, we're seeing a lot more kids presenting with symptoms that are very similar. And in addition, kids are even sicker than sort of the baseline Kawasaki kids that we see this time of year. And many of the kids that we're treating also have antibodies for COVID, are positive, which has brought us to think about maybe there's an association between the two.
And what advice would you give parents, what to look out for their kids, and if they start seeing potential symptoms of this, what I guess we're calling it PIMS at this point?
I think that, certainly if you're at home and your child is having fevers, and your child is having other symptoms such as, abdominal pain, vomiting, diarrhea, having any rashes, redness of the eyes, I would contact your pediatrician and stay in close contact with your pediatrician, because we certainly are seeing a spectrum of this, right? There are children that come into the hospital for observation and are able to go home without any treatment. And then there are those children that require our inpatient care, or even require our ICU care because they're dropping their blood pressures and their heart is affected. So I think it's, the key is really, keeping a close eye and communicating often with your pediatrician, because they may want to do some screening labs or then refer you to our emergency department if, they think the child requires that level of evaluation.
And correct me if I'm wrong, this could happen with children even if they were asymptomatic all the way through potentially even just being a carrier of the virus, right?
Right. So, we're testing these children, checking their antibodies, and they are antibody positive. And the family's saying, what do you mean, Dr. Palumbo? Like, my child didn't have any symptoms, but clearly they have antibodies. So at some point they had the virus, and they just did not display the symptoms, right? And this is sort of what we've been saying all along, is that kids have had more mild symptoms in general than adults.
Okay. Richie, if you just hang on 1 second, I'll get to you right after the break, but we're going to take a real quick break, and they're going to have much more expert advice on how to keep you and your family safe from the coronavirus. And remember, we want to hear from you. Call us with your questions. That number right there at the bottom of your screen, 516-393-1800. We'll be right back. Welcome back to our live coronavirus pandemic special report. Let's bring back in Dr. Nancy Palumbo, the Division Director of Pediatric Hospital Medicine at Cohen Children's Medical Center. Thank you so much again for your time. I know Richie from Long Beach has been patiently waiting, so let's go to Richie there.
Hey, how are you?
How are you? What's your question tonight?
Good. I'm a teacher and a soccer coach on Long Island, and I just wanted to know, in your professional opinion, when do you think the safest time for the public schools would be to reopen?
So thank you so much for your question, Richie. I mean, I think that it's difficult, right, to say exactly when, because there's so much unknown here in terms of what's going to happen to the virus through the summer, in the fall. I do think that this is an opportunity for everyone, right, in all of our different environments, in schools, at work, to really think about our place of work or schools, right? Because I don't think it'll be possible to sort of get back to, kind of what we were doing a year ago, right? I think it's important to think about things a little bit differently, right? How can we continue to ensure our kids receive the education that they need, but safely? So, how do we socially distance? Is there an area for masks? Is that something that we should be considering? More hand sanitizers, right? Like, I think this is an opportunity for us to get very creative in our various environments.
I know universities right now, they're grappling with this right now. Some are thinking, well, I'll start early and end by Thanksgiving, and some are just waiting later and when there's maybe more information out there. So everyone's kind of grappling with the whole thing, right?
Absolutely.
Yeah. All right, so how about Vito from Seaford? Vito, you there?
Yes, I am. Hi, good evening. I think it's great that you have set time aside to have questions answered by the doctor. The question I had was one of many, but I was wondering about traveling to physicians. If you have to take elevators, how safe, and what do you do to restrict yourself from getting contaminated with this? I mean, the gloves, the mask, we do, but is there any worried?
I think that as more and more, thank you so much for your question, Vito. I think as more and more practices begin to open, they are thinking about the things that, we were just talking about. How do they space out patients, right, to ensure that there's not that, waiting room full of patients as maybe, we had, a year ago. And so I do think that the practices are thinking about these things and ensuring that their practice is safe to receive patients. Things like elevators, sure, you can wear gloves, but really it's all about the hand washing, I think, right? So, if you wear a glove to go ahead and press that number 1, you may want to then take it off, clean your hand, have a new glove. Or, I think we're so mindful, certainly if stairs are an option, but then you have to be careful of the doorknob, right? So I think it's the just our heightened awareness, and all going back to the simple hand washing, right? I think is key.
Yeah, I never knew how many things I touched in a day until you have to wash your hands every time. Let's go to Howard from New Hyde Park. Howard, you there?
Yes, hi, how are you?
I'm doing great. What's your question?
I'm in a relationship with someone who works in a nursing home who caught the virus, was hospitalized for about 3 weeks, and now is in the 14-day quarantine. And I was just wondering, after all this, is it okay to have physical contact with her? Will she spread the virus? Is that okay?
You're talking about intimate contact?
Yeah, intimate contact, yes.
Okay.
Yeah, I mean, thank you for your question, Howard. I think that, once she's done with the quarantine and asymptomatic, I would say that it would be safe once she's out of that period. It sounds like she's been hospitalized plus 14 days of, 3 weeks of hospitalization plus 14 days of quarantine. I think she should be safe.
Okay. How about Mario from Freeport?
Hi, how are you?
I'm doing great. What's your question?
First of all, thank you for taking my question. I've been having tremendous anxiety with this new inflammatory virus for the children. Mine tested positive for COVID-19 back in March. Is there like a known time frame between the time the kids who had the inflammatory, did they get it right after COVID? Did a lot of time pass and then they had the inflammatory disease? If that makes any sense.
Okay.
No, absolutely. So most of the kids that we're seeing have antibodies to COVID. So we think that it's at least 2 weeks after they've had the virus, and potentially longer, 2 to 4 weeks potentially that they've had it. Many of the kids that we're seeing didn't even know that they were sick. Some of the parents may have said, yeah, I wasn't feeling well, may or may not have been tested. And so we're trying to figure out exactly the timeline, but we're thinking it was at least 2 weeks, if not a bit longer.
Okay. Unfortunately, that is all the time we have. Dr. Palumbo, thank you so much again for what you do every day and for coming on our show and giving your advice and your opinions, and it's a great, tremendous help to all of us. So thank you very much, and thank you to the viewers, and thank you for watching and for your questions. We'll see you right here tomorrow night at 7. Stay safe. I'm Stone Grissom.